Hi, Doc. Good afternoon.
Hello, good afternoon.
Okay, so hello, everyone. Thank you for joining us today for another informative session with Asian Eyes Facebook Live Q&A. So what we'll be discussing today are the different retinal problems. What are these problems, and who can have these concerns, and how it can actually affect your vision. We'll also talk about how we can protect our vision. So if you have any questions, go ahead and leave a comment below. We'll try to answer them all later. So joining us this afternoon is Asian Eyes Retina and Vitreous Disease Specialist, Dr. Patricia Quilendrino. Hi, Doc. Good afternoon.
Good afternoon. Good afternoon, Audrey. Good afternoon to everyone watching Facebook Live.
Okay, so if you're not familiar with Dr. Quilendrino or you haven't had a checkup with her before, Dr. specializes in retina and vitreous disease as well as cataract and comprehensive ophthalmology. She completed her medicine degree at the University of the East Ramon Magsaysay Memorial Medical Center, and then she obtained her medical internship, residency training in ophthalmology, as well as her medical and surgical fellowship in retina and vitreous disease at the University of the Philippines, Philippine General Hospital. She's a diplomat of the Philippine Board of Ophthalmology, and she's given a number of lectures in local and international conferences. Aside from that, she's also a teaching consultant at the Quezon City General Hospital, and she's the Retina Fellowship Training Officer at Asian Eye Institute, which means she's responsible for teaching a new generation of eye specialists for retina concerns. So, Doc, I think the one thing that caught a lot of people's eye when we came to our particular topic is yung idea na kapag may retina problem ka, baka pwede kang mabulag. Pero ano ba kasi, Doc, yung retina and what is its function?
Okay, so the retina, it is the layer of cells, lining the back part of the eye. So it is you don't see it if you look at the eye, you don't see it, no? So if you could see here, nasa bandang right part siya, no? Sa right part of this drawing. And so this is the layer that is responsible for sensing light and for sending signals to the brain, no? So we interpret what we see. That is the function of the retina.
Okay. And then, what does it mean, Doc, kapag merong damage to the retina? Ibig sabihin ba noon, wala ka na magagawa? Bulag ka na ba agad?
No, hindi naman, no. It will depend on the condition kung paano na damage yung retina, but most of the retina conditions, most of the retina diseases can be treated and cured, especially if they are caught early. Mm-mm.
Okay. And then, what are the common problems, Doc, when it comes to the retina?
So, more common cases we encounter sa retina would be retinal detachment, diabetes damage to the retina, that's called diabetic retinopathy, macular degeneration, and quite common for the younger patients now would be central serous chorioretinopathy or CSR.
Okay. So first off, I think yung one of the more common conditions that we're familiar with is yung retinal detachment. So what is it and how does it affect naman your vision?
So retinal detachment, that is when this layer in the retina, no, it separates from its attachment, kaya siya tinawag na retinal detachment. So ang nangyayari is meron tayong yung layer na to, no. So usually pwedeng magkaroon ng butas, pwedeng magkaroon ng retinal tear, and this retinal tear, the water inside their eye will go through this hole, which will cause the detachment of the retina, no. um, and this can cause blurring of vision. This can cause um, magkakaroon ng curtain-like symptoms, yung parang didilim, no, didilim yung paligid, and that will usually mag-worsen siya over time until you are unable to see well, no. And if it's retinal detachment and it's not the usual treatment for retinal detachment is surgery. Mhm.
Okay. And then, Doc, who is more likely to develop yung retinal detachment?
Yes, most likely to develop retinal detachment would be pwede yung mga nag-undergo ng aging sa mata, no? So, it could be 40 and above. Pwede rin kapag merong family history of retinal detachment, baka mas may risk that you get retinal detachment as well. If you are nearsighted, yung mataas yung grado, lalo na nearsighted would be you sight the near, no? Or myopic. So may ibang mga nearsighted who are more at risk to develop this, no? So yon. Other things
Okay.
would be surgery and if you have diabetes. Yes.
So if, let's say, na-injure ka rin sa mata previously, you're more likely to develop it.
Yes, pag merong previous eye injury, pwedeng nagkaroon ng weakness in your retina that pwede ka ring magkaroon ng retinal tear or detachment later on.
Okay. And then, Doc, sinasabi kasi nila na kapag mataas yung grado mo, it's really something that can put you at risk of retinal detachment.
Yes, that's right, Audrey. So, minsan, pag mataas yung grado, one of the reasons kung bakit mataas yung grado ng mata is kasi humahaba yung mata, no? Nag-elongate, no? Nag-elongate yung mata, and when the eye elongates, no? Hindi na siya yung perfect sphere, no? Medyo nag-elongate siya. The retina is also stretched out, no? Because of the elongation of the eyeball. And it is this stretching of the retina na pwedeng maging prone sa sa thinning, sa thinning or sa tears, no? So that's why kapag mataas yung grado, pwedeng may risk na mas may risk magka-retinal detachment.
And then, Doc, how would you know that you have a retinal detachment? What are some symptoms that we should watch out for?
Yes, so that's very important, Audrey, no? Kasi you don't see the retina outside eh. So we base it on the symptoms, no? So some common symptoms na may retinal detachment na pala or may precursor would be floaters. So floaters
Mm-hmm.
would be parang dots or lines, no, following your vision. So like in this photo, na merong nakikitang mga spots, no? And these usually move, no? When your eye moves, sasama sila. So that is how floaters behave, no? That is how you see the floaters. You may also get flashes of light. So the flashes of light, sila yung parang may mga kislap, no? May kislap dun sa gilid, no? Um, or sinasabi parang flash ng camera. Some patients would also describe it as parang merong kidlat. It's fleeting, it's very rapid, no, mabilis lang siya, but they may occur several times in a day. So those are flashes of light.
Okay.
Also, as I mentioned kanina, yung curtain-like symptoms, no? So parang merong veil or merong curtain na dahan-dahang magko-cover sa field of vision mo. They may start at one corner or at one side, and then they will eventually cover your whole vision. That's the curtain-like shadows. And eventually, yun nga, blurring of vision, lalo na pag progressive na yung detachment, it involves your macula.
Okay.
Mhm.
So, Doc, so that's for retinal detachment. But
Yes.
how about yung sinasabi niyong diabetic retinopathy? Can you tell us more about this?
Yes, no? So diabetic retinopathy, so diabetic, so it's a complication of diabetes sa retina. So it can happen because of prolonged diabetes. So if you are diabetic, no, sila yung mas prone talaga mag-develop. And the uncontrolled blood sugar can damage the blood vessels in your retina, and these can cause the different disease spectrum, no, ng diabetic retinopathy. Pwedeng walang masyadong impairment sa vision hanggang sa something that requires surgery, and something na baka pwedeng hindi na ma-save, no, if it's in that advanced cases. So yeah.
And then, Doc, you said that this is specifically for people that have had diabetes. So does that have something to do with how long they've had the diabetes?
Yes. That is one of the risk factors for developing diabetic retinopathy, the duration. of the diabetes, no? So, especially for those who have had it for 5 years or more, no? Poor control of the sugar. Ano. So kapag kahit sandali ka pa lang may diabetes, kapag hindi talaga maganda yung control ng sugar mo, baka pag nasilip natin yung mata, meron na palang findings siya, no? High blood pressure, high cholesterol, these are all known risk factors. Pregnancy, no? Pregnancy, the hormonal changes during pregnancy can make you more prone to develop diabetic retinopathy if diabetic ka and you become pregnant. And also, smoking can also damage the blood vessels in your retina. Kaya mas prone din magkaroon ng mga ng damage of the DR. Yes.
And then, Doc, in this photo that's being flashed, so ganito yung difference kapag normal at saka kapag may diabetic retinopathy vision ka.
Yes, oo. Ito yung isa sa mga ways patients see patients with diabetic retinopathy see, no? So pwedeng may blotches or patches sa vision nila. There would be some areas that are clear. Ito pwedeng may swelling sa mata, no? Yung tinatawag na diabetic macular edema, or this could also be because of hemorrhage, no, from advanced diabetes. Kaya magkakaroon ng ganitong mga ganito yung nakikita ng isang patient with diabetic retinopathy.
So you mentioned, Doc, na some of the signs kasi are yung floaters, of course, tas pwedeng parang nag-blur din yung vision mo, no?
Yes.
How about for patients, Doc, na parang nag-fluctuate? Let's say today, parang malinaw siya, and then tomorrow, it seems like your glasses don't work. Is that also a symptom of this condition?
That's right, no. May mga patients din minsan bago lang yung salamin tapos after some time hindi naman na siya maliwanag. Pwede ring sign yun of diabetic retinopathy. Meron ding mga patients na it's also because of their sugar levels, no? So parang sa pagkakain mo, after some time it's going to be may transient blurring of vision kasi tumaas yung sugar. That can also happen because of the fluctuation ng sugar sa
So when you
sa
say, Doc, na
system.
transient change in vision, so yon
Mm.
dahil kakakain mo, tumaas yung blood sugar, lalabo. And then
For
siguro,
some, yes, that's
okay,
right. For some, no? Pero not for all, but there are
mm,
some, no? And minsan ito mga patients nito, ano na rin pala yon, parang sign na rin of diabetic retinopathy for them.
mm.
Mm-mm.
So, Doc, kasi minsan, di ba, it's a floater, it's like may patches lang na hindi malinaw sa'yo, pero
Yes.
technically you can see. So, is it possible na ang patient na mayroong diabetic retinopathy could actually have 20/20 vision, assuming na hindi parang nag-affect yung sugar sa vision niya at that time?
Yes, that's a very good question, Audrey, no? Kasi there are a lot of patients, diabetic patients, who do not feel the need to have their eyes checked. Kasi maliwanag naman yung mata, 20/20 naman
Mhm.
yung vision. Pero pag sinilip namin, meron na palang mga signs na pwede nang mag-advance. Pwede nang advance yung diabetes nila sa mata. And they are at risk for vision loss. So, that's why it's really important, no? We always stress to kapag diabetic, it's best if you have your eyes checked, lalo na pag type 2, you have your eyes checked upon diagnosis. So, kung let's say, nagpunta ka sa doktor, pinastart ka na ng gamot for pampababa ng sugar, mas maganda rin na makagpunta na rin sa eye doctor to have a retina check, no? Also,
Okay.
if you have, tapos kung type 1 naman, dapat within 5 years, type 1 diabetes within 5 years of your diagnosis. And if you are a
Okay.
diabetic who is pregnant, mas maganda din to have your eyes checked within the first trimester. So, yun yung mga recommendations for this screen.
So, Doc, ano yung difference sa treatment kapag medyo maaga mong na-catch yung diabetic retinopathy or kapag advanced na yung nakita?
Yes, malaki. Malaki ang magiging difference, no? So if you catch it early, you're able to give treatments early, there's a very good chance we can save the vision, no? Kasi
Mhm.
mami-minimize natin yung damage eh. Pero kung advanced na, no, something that requires surgery o yung iba, may diabetes, meron na rin mga ibang complications, no, like nagkaroon na rin ng glaucoma o nagkaroon na rin ng stroke. Those are the ones that are really hard to save. Kaya very important na ma-detection ng maaga. And kung and if you are able to control your blood sugar and the other risk factors, um, mas liliit din yung chance na magkaroon ka ng advanced retinopathy.
Okay. And then, Doc, ano ba yung treatment typically for diabetic retinopathy?
Yes, so there are several treatments available. It will depend on the type of condition that you have. So there is, so you have your injections, ang anti-VEGF injections, no? So we give this. These are injections given monthly, no? It is injected into the eye. Di siya masakit, okay? May anesthesia siya. So yun, no? So this can help stop the progression of the diabetic retinopathy. At saka kung merong swelling, no, it's another complication of diabetes, diabetic macular edema. This can also help treat that, and it can help improve the vision. Yung meron din tinatawag tayong laser, no? So there are different lasers, different kinds of laser used in the eye. So itong laser na for the retina, yung tinatawag na PRP or pan-retinal photocoagulation. So this will make your diabetes quiet. No? So yun naman ang very important siya, no? That can save vision. And for the advanced cases, no, usually ito na yung mga nagkaroon na ng heavy bleeding in the eye or nagka-detachment na because of the diabetes. Minsan we have to do surgery, and this surgery is called vitrectomy.
Okay. And then, Doc, if someone comes to you at meron ng need for, let's say, some of these more advanced treatments, kapag ginawa pa, ibig sabihin, ma-regain yung vision.
We assess it, no? We assess it depending on how severe it is, no? And may mga patients who regain vision, okay? And there are those who we are just only able to maintain vision. So, kaya very important talaga to have regular eye checkups, especially if you are diabetic, no? So, aside from when you get your eyes screened, you also have to get the regular checks, which is around every 6 months, kung walang findings.
And then, Doc, let's say, there are some people, kasi syempre, I'm sure they're walking around, hindi nila alam na actually, meron na silang diabetes or meron silang diabetic retinopathy. Ano yung pwedeng mangyari kung hindi natin siya maagapan?
Yes. If hindi maagapan ang diabetic retinopathy, you may have the complications of diabetes, no? Isa dito yung vitreous hemorrhage. So this is severe bleeding inside the eye. Pag nagkaroon ka ng vitreous hemorrhage, bigla na lang lalabo talaga yung mata mo. You may even see red kasi kapag fresh yung bleeding. No? Another complication would be retinal detachment, as we have explained earlier. Yes. Another thing that another possible complication would be glaucoma, no? And kapag may glaucoma na, mas mahirap talaga ma-save na yung mata, no? And for the more advanced cases, sometimes you are not able to save the vision anymore. So,
It can, in fact, lead to blindness. Basta
yes.
walang treatment, walang detection na nagagawa.
Yes, that's
And then,
right.
Doc, how about some of the more serious conditions? So let's go to macular degeneration. What is it, and paano naman ito nakaka-apekto sa vision?
Okay. Macular degeneration. So we will talk about the macula first. No? So the macula, this is the part of the eye responsible for central vision. So if I explain this to patients, kung yung retina is a dartboard, no? The macula is the bullseye of our vision. So yun yung pinakamaliwanag yung nakikita, responsible for colors, no? And then there are two types. So macular degeneration is nasisira yung macula. So since it is degeneration and it's mostly age-related, no? Kaya siya nasisira. That's why its complete name is age-related macular degeneration. There are two types. There are two types of macular degeneration. So the first is the dry type of macular degeneration, where is ano lang yun, parang progressive thinning progressive thinning ng retina, no? And nagkakaroon din ng mga deposits sa retina eh. Kaya din humihina yung retina, no? So this is the dry type. Meron din yung wet type. So yung wet type, you have there are abnormal blood vessels na tumutubo, no, under the retina. And these abnormal blood vessels can leak. Pwede siyang magkaroon ng leakage, pwede siyang magkaroon ng bleeding, no? And ang effect ng macular degeneration is you're gonna see a sudden black spot in your vision na hindi ka na makakakita. Yung central vision mo will be severely affected. That is how wet macular degeneration usually presents. So, yun.
Kapag ito, Doc, kasi syempre, it must be nakakatakot isipin na parang may nagkakaroon ka ng dark spot in your vision.
Yes.
Can it actually lead to complete blindness kapag meron ka nito?
Usually, hindi. Where yung complete blindness kasi ibig sabihin nun, wala na talagang nakakita, both central and peripheral, no? So, as we see here in the photo, the macular degeneration, the vision of a patient with macular degeneration, mas central yung nasisira, no? Mas yung center of the vision ang affected. The peripheral vision will remain intact. So that is how that is the vision of a patient with macular degeneration.
And then, Doc, are there other signs that could tell a patient na meron na siya nito? Aside from, let's say, yun nga, yung gitna medyo malabo na or hindi na nila nakikita.
Yes, oo. Pwede rin magkaroon ng distortion or wavy vision, no? So baka pag tumingin sa lines, no, makikita na parang meron talagang wave. And then, pwede rin magkaroon ng decrease in the intensity or brightness of colors. Kung hindi ka man magkakaroon ng blurring of vision sa center, you may also see a gray spot, no? A gray or black spot in the center. That is how patients describe the pag meron silang macular degeneration.
Okay. And then, Doc, with the way you describe it, iniisip ko kasi for like a regular person, one way siguro they might know na they might have these conditions. Kunyari, nagda-drive sila. So if they look at lights, parang wavy na siya or
Yes.
yung mismong linya sa daan.
That's
Hindi
right.
na siya diretso.
That's right. Oo. Or yung iba, sabi, Doc, pagtingin ko dun sa poste, parang merong wave. Or pag tinignan ko yung ilong ng asawa ko, ba't parang naging distorted? So, yan ang common descriptions din ng ibang patients sa amin.
Okay, so that's a sign siguro for our viewers. Kapag yun na napansin mo, that's a sign you need to get checked.
That's right.
And then, Doc, sino ba yung nakakuha nitong macular degeneration?
So, it usually presents sa 6th decade of life. So, mga 60s and above. Tapos, kapag merong family history of macular degeneration, smoking. Smoking is a strong risk factor for developing macular degeneration, especially if you have smoked a lot when you were younger, no? Tapos, obese, those who are obese have hypertension, and, women, these are the risk factors for developing macular degeneration.
And Doc, is it more likely to happen in Asians or Caucasians?
Mas sa Caucasians siya. But we also we also see it here, no? I think primarily yun nga kasi since it's an age-related condition, so mas napapansin namin siya sa mga 70s and 70 or 80-year-old patients natin.
And then, Doc, ano ba yung treatment options mo if this is the condition that you have?
Okay. So, if you have the dry type, no, ang mahirap kasi sa macular degeneration is it's a degenerative disease. So, wala talagang complete cure for this, no? That you're gonna go back, you're gonna get your young macula back, no? Walang ganon, no? So, yun. But, if you have the dry type, the dry AMD, taking supplements, taking vitamins, can delay the progression of the dry AMD, no? So yun. Also maintaining the healthy lifestyle and quitting smoking. Those are the things that you can do, no, to stop your macular degeneration. For the wet type, ito na yung merong bleeding and swelling, di ba, sa macula. So we usually give treatments for this, no? The treatment that we give is kagaya sa diabetes, no? We can also give anti-VEGF injections. Yes, so and there are also different types of laser, no, that we can use for the wet type.
Doc, when you're talking about laser, kasi syempre kapag naririnig ng tao ang laser, immediate sa mind nila minsan
Yes.
LASIK eh. But it's a different kind of
Yes,
laser
that's right. That's right. No, so to differentiate it from LASIK, no, LASIK is remodeling the cornea sa front part, no, sa harap 'yon, sa harap. Pero yung sa macular degeneration na nasa likod 'yon, hindi mo siya makikita. The laser will try to it targets the abnormal blood vessels. Eh. So kapag yung abnormal blood vessel wala siya sa exact bullseye 'yon, pwedeng ma-laser 'yon. Pero kung nandun siya sa exact bullseye, hindi na best ang laser. Mas maganda pa rin yung injections. And the injections, sila yung mas may chance na mag-improve ang vision if you receive the injections.
Okay. And then Doc, we noticed na syempre recently si John Arcilla, the actor,
Yes.
who's quite commonly known as si General Luna. And he recently also won an award actually for his latest movie.
That's right.
He posted about getting treated for central serous condition. And now he's okay. So ano yung nangyari sa kanya, Doc? And what actually causes that condition?
Yes, so this condition, we call it central serous chorioretinopathy or CSR. So, this condition is nagkakaroon ng leak sa behind the retina, no? So it's in the choroid. Bigla na lang nagkakaroon ng leak at nagkakaroon ng fluid buildup, no, behind the retina. This can cause sudden ang visual disturbance nito usually is parang merong gray spot sa center. That's how most patients describe it. May gray spot sa center, hindi siya nawawala, hindi siya gumagalaw, no? Unlike your floaters, no? So, eto pirme lang. Pag tumingin ka sa right, nasa gitna pa rin tong spot, and if you look to the other side, it's still in the center. Some patients may also notice that the vision in that eye na meron CSR mas maliit if you compare to their normal eye. That is how CSR usually presents, no? So, yun yung CSR. Mm-hmm.
So, Doc, aside from the spot, pwede rin bang, other symptoms for that?
Yes,
Could
yes,
be vision
that's right.
blurring.
Yes, that's right, no? So you may have blurring of vision, you can also have distortion, no? Kasi parang din sa macular degeneration, macula din kasi ang na-affect, no, nung mga kadalasang na-affect ng may CSR. Kadalasang na-affect yung macula, yung mga patients who come in with CSR. So ito yung mga pwedeng maramdaman nila. So yun.
So I think in his case in particular, parang akala niya parang blurring of vision lang to, baka pwedeng ma-treat ng salamin.
Yes.
But as out, may
That's
other
right.
condition pala.
That's right. No, so one of the reasons he came in kasi he thought makukuha naman siya sa glasses, and then when he was examined, no, nakita na magi-improve siya sa glasses, but it will not remove that spot in the center of his vision. The glasses will not correct that. And then during the workup, nakita nga na may fluid buildup na pala, no? And when more tests were done, na-confirm that he has CSR.
Okay. And then, Doc, what puts you at risk of developing this condition?
It's quite common for young males, no? So, kadalasan pumupunta sa amin sa clinic, 30s, 40s, no? Tapos, yung iba may history of steroid exposure. Yung iba kasi parang naggagamot for asthma, naka-inhaler, or taking steroids for another condition. Minsan nga, miski mga pinapahid na may steroids, no? Na matagal, na mga matagal nang gumagamit. They may develop this as well. Pwede rin yung mga iba who who supplement with
Okay,
steroids, or who have other endocrine conditions na tumataas yung cortisol or yung stress hormone. Meron
I
ding,
see. So,
yes, oo.
interesting yun doon kasi it's, ano eh, mahirap iwasan ng stress, but it is a reason for you to kind of try to manage your stress levels. Kasi you, pwede palang maka-affect sa mata.
That's right. That's right. Meron din actually oddly study na sinasabi type A personalities daw may develop CSR. They're more prone to develop this. And I think it's because of the stress levels. You're right. No? It's really the high stress has been identified to be a
Mhm.
factor to develop this.
So that means, Doc, I mean, it's more common in men, pero can it also show up sa mga babae?
Oh yes, pwede pa din. Pwede pa rin siyang makita in women. That's right.
And then in his case, parang he just thought blurring of vision, that was it. Can it happen din ba, Doc, na meron ka ng condition na to, pero walang signs at all kang napapansin?
Pwede din. That's a good question. Pwede din na you may have this na pero wala ka palang symptoms. It may happen if the fluid buildup does not affect the macula. So if it's nasa gilid lang siya, ah kung nasa gilid lang siya, wala siyang magiging impact sa vision mo. Kaya hindi mo siya mapapansin. And
Mhm.
it may persist or it may resolve on its own. So, yun.
I see.
Mm-mm.
So, swerte ka kung parang it happens and then it kind of resolves. Pero yung mahirap is if nagkaroon ka nun, hindi mo malalaman and then it affects your vision more seriously.
Yes, that's right. Mm-mm.
Okay. And then, Doc, among the different conditions kasi that you talked about, parang one common sign is yung eye floaters. So, itong floaters pa, is it really normal to have them? Or the second I see it, dapat pa-check ko na agad?
Um, alam mo, that's another good question, no? Kasi it really depends eh. Floaters, as we mentioned, no, parang in the picture, they would present as spots in your vision. Pero when you see floaters, pwedeng part of aging lang siya. Pwedeng may
Mhm.
serious condition na pala, no? Pwedeng may retinal tear na pala, or may retinal detachment, or may bleeding na pala sa mata mo. Pero there is no way to know kung ano ang nag-cause ng floater mo unless you have it checked. That's why there have been a lot of patients who had floaters. They did not mind it. Hindi, okay lang yan, part lang na aging. And then biglang, after a few weeks, ito na yung mga ibang symptoms, lumalabo na.
Mhm.
Yung pala may detachment na pala. And these patients, if they were able to come sa onset ng floaters nila, we might have been able to catch a retinal tear na na-treat na natin early, na hindi na nag-progress, and hindi na nangailangan ng surgery. So, um, pwede pa rin na the floaters can be caused by aging, but there's no way to know if it's just
Okay.
from aging or if meron na palang ongoing condition. So, if you have this, better to have it checked talaga.
So at least parang nire-rule out ka ng mga posibleng problema sa mata.
That's right. That's right.
So Doc, given na medyo stressful kasi isipin na you can actually develop this and not necessarily know about it, ano yung best way to protect your vision and somehow prevent developing these conditions?
So the eye usually responds to their systemic condition, you know. So to prevent these complications sa mata, no, first is the lifestyle, no. So it's best if you have a healthy lifestyle. If you're smoking, you quit it, and if you're able to eat healthy, exercise, and make sure that you go for regular workups as well. Also, as we have mentioned earlier, early detection is best talaga, no? So that's why we recommend getting regular comprehensive eye exams. Because this way we'll be able to detect kung meron na palang mga nagsisimulang mga changes na to, and we can prevent its worsening and maybe save your vision.
And then Doc, how often ba should a person get a comprehensive eye exam? Let's say diabetic sila.
Kung diabetic, at least every 6 months, no? At least every 6 months. If meron tayong findings, we recommend that they come earlier, shorter yung follow-up, no? Every 3 to 4 months. Kung nagre-receive ng treatment, shorter pa din yun kasi we try to monitor kung if they're responding well to the treatment. And yun, mostly that's the guideline for diabetics.
But how about for younger patients na generally wala namang problema sa mata? Is once a year a checkup okay?
Yes, once a year is a good is recommended, no, for to come in for a comprehensive eye check. So we could also see if nagbabago yung grade ng mata mo, if maybe developing some computer vision syndrome or dryness, which is usually mas common siya ngayon, no, with this pandemic. And if there are any eye concerns we can help you with, the comprehensive eye exam is the is the way to go. Parang that's how we're gonna help you. Mm-mm.
And then, Doc, if may nararamdaman kang symptoms, so syempre, typically, you will schedule an appointment. What can they expect when they come for that comprehensive eye exam?
Yes, so sa comprehensive eye exam, so we will check your vision. We will check your refraction to see if you need glasses or if you need to update your glasses. There is also we use a microscope, a slit lamp microscope to examine the different parts of your eye. We also check your pressure to make sure that to check if you are at risk or if you have glaucoma. And we can also check the retina for if there are any conditions or if there are any risks na we can mitigate or we can give you treatments to save to save your vision. No? So those are the usual parts of the comprehensive eye exam. And if there are findings in your comprehensive eye exam, we may recommend more tests to confirm this, no? And so we'll be able to monitor it better as well.
Okay. And then I'm sure kasi ngayon sa panahon ng pandemya, Doc, medyo mahirap kasi magpa-check up, medyo nakakatakot. Is it also possible to do a teleconsultation kapag meron silang certain questions about their eyes?
Yes, we can do that, no? Teleconsultation could be a way to talk to your doctor and share your concerns where you don't have to go to the clinic anymore. Although I will have to mention that it's really different from face-to-face comprehensive eye exam kasi we are also limited by what we can help you with. But um, but still, kung merong mga eye concerns that maybe it might be something that's not so, it might not be serious or like maybe usual na mga nate-teleconsult kasi namin could be something that pwede palang may sore eyes or meron palang kulite or meron palang mga um, could be minor eye conditions, no? Teleconsultation can help you.
Okay. So it really depends. So it's good to know na merong alternative yung mga pasyente if they happen to be very far from the doctor or hindi nila makontakt yung
That's
doctor
right.
na they can't come to visit.
That's right.
And then,
And I just to add to that, sorry, Audrey, just to add to that, no, when you talk to your doctor during teleconsultation, the doctor may be able to tell you how severe your condition is, and so if it's something that warrants an eye checkup right away. So those things you can get from your teleconsult, and para mas maging directed din yung magiging treatment sa'yo when you come in for your face-to-face consult.
okay. And then I guess, Doc, another thing to consider is yun nga, if you're worried or lalo if it's related to something like diabetes, mas maganda pa rin talaga yung makita ka ng doctor mo. Kasi, especially let's say you're newly diagnosed, you want to get yung parang baseline checkup mo with your doctor para as time passes, pwede niya mabantayan yung progression ng kondisyon ng mata.
That's right. That's right. For diabetics and for those who have retina concerns, we encourage them to come in to the clinic kasi that's the only way we can examine the retina.
Okay. And then, Doc, we actually have quite a number of questions through our Facebook comments. So the first from Rizal Navarra: Can lattice degeneration be cured?
Lattice degeneration, that is the thinning in the retina, no? Usually nakikita mo yan sa gilid. And it's more common for those who are nearsighted or the ones who have the elongated eyeballs. So the lattice degeneration cannot be cured such that this thinning will go away if you give it a treatment. But we usually monitor it. And if we see signs that it is high risk na magkaroon siya ng retinal tear, we offer the laser as we have discussed earlier. This laser we will put a barrier around that lattice, no? We're gonna put that, and this will reinforce that weak area dun sa lattice. So yeah.
Okay, so parang ano eh, like the way that you describe it, Doc, talagang you're just strengthening the eye so that it doesn't actually lead to a tear.
Yes. Yung iba, we call it, pinu-welding namin, no? That weak area. So, gano'n.
Oo, pwede. That
Yeah.
makes sense.
Mm-mm.
And then the next question from Rolando Del Rosario: Doc, my cataract both eyes is already matured. My vision is quite clear. Can I delay it for operation? Um,
I think he
I
uses a
think,
medicine. Yeah.
yeah, I think he needs to mention to delay the progression. Oh, can I take something to delay the progression of my cataract?
All right. Sige. So, cataracts with both eyes, nasabihan na daw na mature, probably a consult was already done. But the vision is clear. For me, no, and the common recommendation pa rin for cataracts is to check if there is still functional and good vision, even if you have the cataract. So, if the cataract is present, but this patient still has good vision, di ba naman siya nahihirapan, lalo na wearing glasses, the vision still improves. We can delay the removal of the cataract. But there will come a time though na when the cataract becomes more thick and it becomes more mature, even if you wear glasses, the vision does not improve anymore, no? O yung iba naman sobrang silaw. That's how their cataract presents. Ito na yung mga candidate for surgery.
Okay.
Regarding medicine for cataract, there are a lot of medicines, anti-cataract in the market, but I'm not a fan of those.
Uh,
And because cataract is an age-related condition as well, no? Lahat tayo magkakaroon yan. So, ganun.
with the way that you're describing it, nga, Doc, it's like with any other thing na age-related. Kunyari, pagiging pamumuti ng
That's
buhok.
right.
It's like something in the market telling you na ititake mo to, hindi puputi yung buhok mo. But in reality, it's part of aging. You're
Yes.
gonna go through it.
Yes.
So hindi necessarily accurate for any medication to say that it can actually stop it.
That's right. For now, yan ang, sa mga available medicines in the market, there is no medicine that can really prevent cataract. Yeah.
And then ito naman, a question from Marcel Cartoneros. Ask ko po, lumalabo po ang mata ko since diabetic po ako. I use magnifying glass to read kasi nasanay po ako na nasa paggamit nito. Ang question ko po, mas masisira po ba ang mata ko kasi magnifying glass ang gamit ko instead of lamin?
Okay. Thank you, Marcel, for your question. No, so lumalabo yung mata niya since diabetic daw siya. Okay. Siguro one of the questions for this case is what is the reason kung ba't lumalabo yung mata niya, no? So is it from diabetes o baka meron na ring cataract or any other condition? So kasama yung grado ng mata, no? So if sinasabi niya na gumagamit siya ng magnifying glasses, there might be something going on inside the eye already, no? Kagaya mga na-mention ko. And kung makakasira ba sa mata na gumamit ng magnifying glass, not necessarily. But it may not be the best. It may not be the best unit. Yes,
Solution.
it may not be the best assumption. And there may be something else we can help you to improve your vision, no? So Maybe if you come in for an eye exam, makita natin may cataract ka pala, cataract lang pala, and if you undergo that 15-minute procedure, liliwanag na yung mata mo. You do not need to use your magnifying glasses, and you may not need to wear glasses anymore if the cataract surgery is able to restore your vision.
Okay. And then that's interesting kasi minsan nga ayaw natin magpa-check kasi natatakot tayo for the result. But in fact, it could be the key to finding the solution that will fit yung pangangailangan ninyo.
That's
And
right.
then the
That's
next
right.
question naman from Gloria Dumagoso. Na-opera po ako sa retina detachment. Bumabalik po ba yon?
Um, the risk of having a retinal detachment after surgery is I'd say mga 20% to 40%. It will depend po kasi, Miss Gloria, no, kung ano yung cost ng retinal detachment, ano yung treatment na nagawa sa inyo, no? So, marami po kasing factors kung para masabi kung babalik pa ba yun. But usually, pag na-attach naman ho yung retina, wala nang ibang naging problem, the retina can remain attached for years. So, yun po.
Okay. And then related Doc, yung next question from Eileen Medrano, Catillo. If you undergo focal laser to prevent retinal detachment, does it mean you are safe now and the retina will not detach anymore?
Okay. Sige, ganda ng mga questions natin. Sige. So, Miss Eileen, the focal laser can prevent retinal detachment, yes, in that area where you had the laser. So, imagine mo yung retina, di ba, para siyang face of a clock, no? From 1 to 12, no? 1 to 12, no? And then, the focal laser it might be given it might be placed from between 1 to 3 o'clock. So, yung area na yon, reinforced yon ng laser, yung 1 to 3 o'clock. But the other areas, hindi na siya reinforced by the laser kasi focal laser lang yung ginawa. So, it's no guarantee na there's no guarantee that focal laser can fully prevent 100% prevent retinal detachment, but it decreases your risk. And one of the factors to consider is what area in your retina has received the focal laser.
Okay. So it's good to be aware of exactly where it was
That's
done.
right. Mm-mm.
And then, Doc, ito naman a question from Manuel Custodio. Na-opera na po ako for retinal detachment 1 year ago, but until now, distorted pa din ang tingin ko. Pa-advise po.
Okay. So, ang retinal detachment, so parang kung ganito siya, no? Nag-detach yung retina, okay? Tapos nag-surgery na attach siya. Pero yung attachment niya, hindi siya yung ganyan, no? So, minsan may mga cases na medyo ganito yung pag-attach. Hindi siya yung lapat na, kasi, hindi siya yung sobrang lapat na bumalik doon sa dati niyang location. And that may
Okay.
explain the distortion that you are still seeing. For some patients, nababawasan tong distortion na to over time, no? Alam ko it's been a year already since your surgery, but there are patients who still have less distortion over time. And there are some din na even if there's less distortion, hindi talaga siya nawawala. But that is, kumbaga, kasama na yun sa ine-explain namin sa patients who will have retinal detachment surgery, that this thing can happen.
Okay, it's part of the risk
Mm-mm.
of having the
That's
condition.
right.
And then, Doc, from Eteng Villanueva, I'm 61 years old, nagluluha ang mata ko, lalo na pag nasa harap ng computer or cellphone. Ano po kaya ito?
Okay. So, nagluluha yung mata, lalo na pag nasa harap ng computer or cellphone. Most common na nagkakos ito is dryness, dry eye syndrome. No? So, nagtutuyo yung mata. Dahil nagtutuyo yung mata, ang reflex, nagkakaroon ng reflex tearing, no? Nagpo-produce ng more tears. Pero hindi naman, yung pagluluha na yon does not necessarily treat the dryness. So, ang gamot dito, no, is you have to minimize yung paggamit ng gadgets, no, how long you use a gadget at one time. You also have to rest your eyes, and you also you will also benefit from using lubricants, no? Para mag-improve yung dryness sa mata. That is the most common cause ng pagluluha.
Okay. And then ito, Doc, an interesting question naman from Thelma Agagas. Ano po ang treatment sa macular hole? Urgent treatment po ba ang needed dito?
Okay. So, ang macular hole, so nagkaroon ng butas, no? Nagkaroon talaga ng butas dun sa macula as the name suggests, no? Ang symptoms nito, nagkakaroon din ng panlalabo sa mata at nagkakaroon din ng parang black spots sa vision, just like with any other macular condition. Kung urgent ang treatment nito, meron tayong tinatawag na parang golden period of treating macular hole, which is 6 months, no? 6 months sa onset ng symptoms kasi sa 6 months, ito yung pag nasara mo yung butas, which is also done by surgery, no? So pag nasara yung butas, ito yung mas maganda yung chance na makaka-recover yung vision. Although hindi na babalik sa dati, hindi na babalik sa perfect, but the vision will improve. Maganda yung chances ng improvement sa vision pag nagawa ito within 6 months. But if it is done beyond 6 months or taon na since na-diagnose ka ng macular hole, baka kahit maging successful yung operation, hindi na masyadong lumiwanag yung paningin. Kaya
Okay.
urgent ang treatment,
Important.
yes, especially if the symptoms are present within 6 months or less. So yeah.
Okay. And then from Laarni Kamayang, for a patient with an autoimmune disorder, taking hydrochloroquine, may effect ba ito sa retina at meron bang prevention or cure?
Okay, so meron talagang hydroxychloroquine retinotoxicity na tinatawag, no? And pwede itong makita, ang recommendation sa pag-screen nito is mga 3 to 5 years na
Okay.
pagte-take na hydroxychloroquine. So kung meron ba siyang prevention or cure, ang importante kasi dito is the detection, no? Yung detection. So may mga test tayong ginagawa para ma-detect kung meron ito at kung may mga nagsisimulang signs na, we will advise your doctor to change your dosing or to change your medicine para ma-prevent natin yung paglala ng retinal toxicity.
Okay.
Mhm.
So yun, important that you talk to your doctor about it.
That's right. Mhm.
And then ito, Doc, this is something you discussed earlier, pero the question is how to treat eye floaters po.
Okay. If it is from aging of the eye, most of it will depend on the floater, no? So most of the time we don't advise treatment kasi it does not cause any harm. Meron din naman who really want treatment, pwedeng laser, pwede tayong mag-laser for floaters, pero hindi lahat ng tao who want laser treatment for their floaters are candidates for this laser kasi it will depend on the type of floater that you have. So yun. Sa other countries, they do surgery for this, but hindi siya common practice dito sa Pilipinas.
Okay. And then the next question naman from Eileen Medrano. Yung akala ko dati, yung sa akin po, akala ko normal yung floater since first year lang nagsasalamin na ako. Buti maaga na-detect, may maliit na tear na pala ako caused by myopia. And my eye doctor recommended the focal laser. And will I still be at high risk of retinal detachment kahit magpa-LASIK ako?
Okay. So, very good yung eye doctor mo kasi na-detect niya yung tear, no? At at na-recommend niyo na mag-focal laser ka, and I hope you underwent the focal laser. If you are at high risk for retinal detachment, kung magpapa-LASIK ka, if you had the laser, not as high risk, it's not a high risk anymore if you had the reinforcement laser, no, in your retina. We have a lot of patients then pag nag-undergo na ng laser sa retina during their LASIK screening and they undergo their LASIK, wala namang nagiging complications and they do very well. So, but then, sa mga ganitong cases, it would be best kung magpapa-LASIK screening ka, kasi the LASIK screening will also determine kung good candidate ka and kung meron pang mga ibang mga factors sa mata mo na kailangan ma-examine at maayos muna before you have your LASIK.
Okay, so it's good to actually get it checked again just to be sure.
That's
And
right.
then the last question naman from Romy Corona, diagnosed with retinal detachment 3 years ago in the left eye and advised to undergo operation. The right eye already underwent laser, but until now I have not yet done the procedure for the left eye. What are the consequences of prolonging the operation?
Okay. Thank you, Mr. Romy, for your question. So, um, there is yung retinal detachment, kung mag-prolong yung surgery, hindi magawa yung surgery right away, pwedeng malimit yung vision improvement that you may gain from the operation. So, kasi habang mas matagal na nakadetach yung retina, nag-undergo ng damage dito sa retina, no, because it does not receive the proper nutrition, the proper kumbaga it is not in its proper environment, no, for it to function. So the pag mas matagal nakadetach yung retina, mas nag-undergo siya ng damage,
Mhm.
and even if naging successful yung surgery, pwedeng malimita yung improvement sa vision that you may gain because na-delay yung surgery.
Okay.
So that's why for retinal detachment, no, we usually advise surgery at the soonest possible time para ma-stop yung damage at malimit at mas gumanda yung chance na mag-improve yung vision natin.
Okay. And then, Doc, in case there are patients who are watching us today that want to actually schedule an appointment with you, saan ka ba nila mahahanap?
Okay. I have clinic in Asian Eye in Trinoma every Monday, Rockwell every Wednesday and Friday, and in Alabang every Saturday. So
Okay.
you can call or message us if you want to set an appointment.
Okay. And then actually, Doc, may humabog pa na question.
Okay.
Ano po ang cause ng pagputok ng ugat sa mata po? And ano ang do's and don'ts para hindi na pumamula or magdugo ang mata?
Okay. I think this is a common concern, no? Yung pagputok ng ugat sa mata, I think what si Miss Joanna is referring to the subconjunctival hemorrhage that we usually see. So yung napapansin kadalasan na pumuputok na ugat sa harap, yun yung para nagkakaroon ng pamumula, na nakakatakot, no? So yeah, so pwede talagang mangyari yon. Mas common siya nangyayari sa mga hypertensive or kapag nagkaroon ng mga pagkakataon na nagbubuhat ng mabigat, may exertion, napalakas yung ubo, nakamot yung mata na mahigpit, and half of the time wala talagang dahilan, nagkakaroon lang ng ganun, no?
Okay.
Ano ang mga do's and don'ts? Siguro, para maiwasan yon, do not rub the eye, do not touch your eye as much as possible. And if you have hypertension, good control of the hypertension.
Okay.
To add to that, pwede rin kasing may mga iba pang ugat na pumutok sa mata. No, maraming layers kasi siya. So pwede rin merong ugat na pumutok sa retina, no? And that may also cause blurring of vision. Hindi mo siya makikita, pero mararamdaman mo siya na panlalabo at makikita lang yon during your comprehensive eye exam.
Okay.
So mas mabuti pa rin to have the eyes checked.
Okay. So that's good. So if you have this particular symptom, syempre nakaka-stress siya. It's actually mas maganda siyang ipa-check na agad.
Yes, that's right.
And then, Doc, I believe that you're also looking for fellows. Can you tell us a little bit more about that?
Okay. So Asian Eye, in Asian Eye we have Retina Fellowship, no, where we train retina, we train um, we train retina specialists. So it's a 2-year program. First year is medical retina, second year is surgical retina. So the applications are open for this year. The deadline of the submission of the requirements is October 31. So if you are an eye doctor and gusto mo mag-retina, you may want to consider applying with us sa Asian Eye.
Okay. Sige, so yan, we've flashed the details so they can read more about it. So thank
Thank
you,
you.
Doc, for spending your afternoon with us. We learned a lot about yung mga retinal problems. Do you have any last advice for our viewers?
Thank you, Audrey. Thank you, Audrey, for having me here and for making this interview flow very well, and was able to share some some I was able to share some things about the retina, no, and its condition. So um, if you have common eye retina conditions would be floaters, flashes of light, yung veil-like symptoms, saka blurring of vision. If you have any of those, it's best to have your eyes checked talaga. No? So, um, our clinics are open and we'd love to have you. Thank you.
Okay. Sige, thank you so much, Doc, and have a
Thank
good
you.
afternoon.
Good afternoon.
Okay. And then for everyone else watching, though, if you're interested in our teleconsultation service, you can avail of it for as low as 300 pesos. Just call our teleconsultation hotlines so you can talk to Dr. Quilendrino or any Asian eye doctor. You can also visit asianeyeshop.com if you need a new pair of glasses, contact lenses, PPE, or even restock your eye drops. Asian Eye ships nationwide, and we are currently have some promos. So that includes free shipping for purchases over 1,000, a free upgrade to UV plus blue light lenses for daily specs and kid specs frames. We also have contact lens bundles as well as a promo. Now, if you buy two Blefa gel, you get one free Haya back, or buy five Haya back and get one free Haya back bottle. So that's a savings of about 683 pesos, all available on asianeyeshop.com. If you want to try our services at discounted rates, we also have electronic gift certificates, a family eye care package, two adults and two kids for only 5,840, and a LASIK buddy package. So that's two LASIK screenings for only 4,000 pesos. So you can purchase these GCs now and avail of them later. So Asian eye clinics remain open to serve and take care of your eye health. If you need to get your eyes checked, book an appointment by the numbers flashed on the screen, and you can also message us through Facebook, Twitter, or Instagram. Once again, thank you so much for joining us today. See you on our next Facebook Live session. Ingat!